Hello, I'm Jose Roca from Lima, Peru. Sorry. I'm going to share with you this work about subliminal yellow laser versus PDT in the treatment of central serous chororetinopathy. As an introduction, the central serous chororetinopathy is characterized by choroidal hyperpermeability, RPE detachment, and neurosensory retinal detachment. In most patients, it resolves spontaneously, but in approximately 50% of patients, it recurs. So this patient will need several treatments in his lifetime. In some patients, the disease becomes chronic and it compromises sometimes severely the vision. Now, subliminal lasers eliminate the iatrogenic damage caused by a thermal laser because it only causes photostimulation. And the yellow wavelength has advantages that the RPE and the hemoglobin has high absorption, and the xanthophyll pigments of the macula have low absorption of this wavelength. The multi-spot technology makes confluent treatment possible, have a lower risk of not treating an area in the retina, and has a greater efficiencies, and we usually do this in a low duty cycle manner. So which one is more effective, PDT or subliminal laser for central serous chororetinopathy? This work of Chen and co-workers with comparison of photodynamic therapy using half dose or half fluency in the last life for the treatment of chronic central serous chororetinopathy. And they conclude that both forms of PDT, half dose or half fluency, are effective, improving visual acuity and eliminating the subretinal fluid. Despite the reduction in dose or in fluency, there is still choroidal hypoperfusion in these patients. So we did in the PACORIS group, the Pan American Collaborative Retina Study Group, we did this work and published this paper several years ago about the yellow micropulse laser versus half dose verteporfin photodynamic therapy in eyes with chronic central serous chororetinopathy. The purpose of this work was to compare the anatomical and functional outcomes of eyes with chronic central serous chororetinopathy treated with subliminal yellow laser versus half dose PDT at 12 months of follow-up. This was a comparative retrospective study of 92 eyes with chronic central serous chororetinopathy treated with subliminal yellow laser versus 67 eyes treated with half dose PDT. And the chronic central serous chororetinopathy was defined as having subretinal fluid of 6 or more months. The method subliminal laser, yellow laser, was with a duty cycle of 5%. The pulse duration was 200 milliseconds with high density 7x7 with not space between the spots. The spot size varied between 100 and 200 microns. And the power selection was by titration, and you know how to do a titration. The power varied between 320 and 660 milliwatts. The PDT was half dose, so 3 milligrams per square meter, with an infusion of 15 minutes, followed by one spot laser of 83 seconds, and the spot size varied between 400 and 2,000 microns. What are the results? These are the basal results of the two groups, subliminal laser group and half dose PDT group. The mean age was about the same, 44 eyes and 44 years and 47 years. The mean duration of symptoms was 9.5 months in the subliminal laser group and 15.8 months in the half dose PDT. And this is different. There was a different statistical difference in this item. The mean central macular thickness was 402 microns in the subliminal laser group and 352 in the PDT. So foveal choroidal thickness 410 and 421, and the base corrected visual acuity was 0.41 in the subliminal laser 2051 and 0.50 logMAR in the PDT group 2063. What are the results in the 12-month follow-up? The mean central macular thickness improved from 402 to 310 in the subliminal laser group. It was a statistically significant, and also was a statistically significant reduction in the half-dose PDT from 352 to 224 microns. The mean subfoveal choroidal thickness went down from 410 to 393 in the subliminal laser group, and this was not a statistically significant, the reduction. And in the contrary, in the half-dose PDT, it went from 421 to 335 microns, and this was a statistically significant. And the base corrected visual acuity improved from 0.41 to 0.21, from 2051 to 23D232 in the subliminal laser group, and this was statistically significant. And in the half-dose PDT, improved, but less improvement from 0.50 to 0.47, about the 20/63 to 20/59 in the PDT group, and this was not statistically significant. The patient has had 3 lines or more of improvement from baseline in the 40.9% of patients with a subliminal laser, and only 19% of patients with half-dose PDT. And the visual acuity remains about the same in 2 lines from the baseline in 48.9% of patients with subliminal laser, and in 73% of patients in half-dose PDT. And has loss of vision, 3 or more lines of loss of vision in 2.2% of patients with subliminal laser, and in 7% of patients with PDT. The mean number of treatments was 1.35 treatments in the subliminal laser group in 12-month period, versus 1.10 treatments in the half-dose PDT in the same 12-month period. And the persistence of subretinal fluid after the treatment, after the 12-month treatment, was 7.6% in the subliminal laser group versus 4.5% in the half-dose PDT group. You can see here the best corrected visual acuity, the green line, the patient with PDT, the visual acuity remains about the same, and it has some improvement of visual acuity in the subliminal laser group. On the contrary, in the central macular thickness, the central macular thickness improved in both, but has a little bit more improvement in the PDT group. And also in the foveal choroidal thickness, the improvement was less in the subliminal laser group versus PDT, half-dose PDT. What about the recurrences? The recurrences was more frequently in the subliminal laser group, 24.5% in the laser group versus 10% in the PDT group. What about the complications? We have no complications in the subliminal laser group versus only 1 patient in the PDT group that developed a CNV membrane that was a successful treatment with 3 doses of bevacizumab. This is one of those cases treated with the subliminal laser yellow laser. The best corrected visual acuity went from 20/80 to 20/30 in this patient, and also a successful case treated with half-dose PDT from 2200, and you can see the chronicity of this patient, from 2200 to 2070 with the resolution of the subretinal fluid. This is work from Schultz in comparison of subjective micropulse laser treated on half-dose photodynamic therapy in patients with chronic central serous retinopathy. And they show that in the group, subjective yellow laser is more effective in achieving response than half-dose PDT. What are the advantages of subliminal laser versus PDT? There are several advantages. The subliminal laser does not produce choroidal ischemia. Therefore, there is not increase in the VEGF production. You can see here in this angiography, you can see hypoperfusion, this choroidal hypoperfusion that is produced after only 1 spot of PDT treatment of the laser of the PDT. The treatment with laser is safe, may be repeated several times. There is no risk of drug sensitivity. We don't have any injectables. The subliminal yellow laser treatment from central serous chorioretinopathy is cost efficient, shorter in time, has no side effects or postoperative care. We don't have to avoid the laser. We have no injections. We don't have to avoid the sun radiation for 40 plus hours, and that was useful to do in the PDT group. And also, this is patient with a sunburn after extravasation of the Visudyne, and the patient exposed his hand to the sun, so that he has this burn. Also, the PDT, the Visudyne is no more available in Latin America, and the access to laser is very easy. And the results are equal or superior in the subliminal laser group than in PDT. This is some of my personal experience with 62 patients treated for chronic central serous chorioretinopathy from 2014 to 2016. 95% of these patients were male. The median age was 34 years. The best corrected visual acuity was 20/40 with a choroidal thickness of 404 microns. In about 6 weeks, the vision improves to 20/25, and the choroidal thickness went to 318. 3 patients improved 3 or more lines of visual acuity. 38 patients improved from 1 to 3 lines. 11 patients has no improvement, and no patient lost vision. This is one of my patients. The visual acuity is 20/40 in this right eye. And you can see here the fluorescein angiography with some hyperfluorescent spot in the right eye, also in the left eye, but in the right eye is the one with the central serous chorioretinopathy. And after only 22 days, the vision acuity improved from 20/40 to 25, and the fluid, supraretinal fluid disappeared. This is another patient with a central serous chorioretinopathy in the left eye. You can see here the hyperfluorescent spots in the left eye. And this is previous to the treatment. You can see in the left eye the supraretinal fluid. And after treatment, you can see that the chorus is about the same, but the fluid, the fluid went down, and the visual acuity of this patient improved very much. In the difference, you can see here the dates. So it's about a little bit more than 1 month after the treatment, with only 1 treatment. In summary, subliminal or subdermal laser treatment from central serous chorioretinopathy is safe, is efficient, has good results, is available all over the world. It's cost effective, and both treatments, subliminal yellow laser and half-dose PDT, are effective in restoring macular anatomy in active chronic central serous chorioretinopathy. But apparently, subliminal yellow laser has better visual acuity results than half-dose PDT. So thank you very much.